Thank you, Madam Deputy Speaker. With your permission, I will make a statement to the House on Fit for the Future, the Government's 10-year health plan for England. There are moments in our national story when our choices define who we are. In 1948, the Attlee government made a choice founded on fairness, that everyone in our country deserves to receive the care you need, not just the care you can afford. It enshrined in law and in the service itself our collective conviction that healthcare is not a privilege to be bought and sold, but a right to be cherished and protected. And now it falls to our generation to make the same choice, to rebuild our National Health Service and protect in this century what Attlee's government built for the last. That is the driving mission of our 10-year plan. In September, Lord Darcy provided the diagnosis. The NHS was broken by 14 years of Conservative underinvestment and by their catastrophic top-down reorganisation. In the past year, Labour has put the NHS on the road to recovery. We promised 2 million extra appointments, and we've delivered more than 4 million. We promised 1,000 more GPs on the front line. We've recruited 1,900. We've taken almost 250,000 off waiting lists, cutting waiting lists to their lowest level in 2 years. And we've launched an independent commission, chaired by Baroness Casey, to build a national consensus around a new national care service to meet the needs of older and disabled people into the 21st century. Today, the Prime Minister has set our prescription to get the NHS back on its feet and make it fit for the future. Our plan will deliver 3 big shifts. First, from hospital to community. We will turn our National Health Service into a Neighbourhood Health Service. The principle is simple. Care should happen as locally as it can, digitally by default, in a patient's home if possible, in a neighbourhood health centre when needed, in a hospital if necessary. We'll put neighbourhood health centres in every community, so you can see a GP, nurse, physio, care worker, therapist, get a test, scan or treatment for minor injuries all under one roof. The NHS will be organised around patients rather than patients having to organise their lives around the NHS. It will be easier and faster to see a GP. We will train thousands more, end the 8 a.m. scramble, provide same-day consultations and bring back the family doctor. If you are someone with multiple conditions and complex needs, the NHS will co-create a personal care plan so your care is done with you, not to you. Pharmacy will play an expanded role in the Neighbourhood Health Service. They will manage long-term conditions, treat conditions like obesity and high blood pressure, screen for disease and vaccinate against it. And we will reform the dental contract to get more dentists doing NHS work, rebuilding NHS dentistry. And over the course of this plan, the majority of the 135 million outpatient appointments done each year will be moved out of hospitals. The funding will follow, so a greater share of NHS investment is spent in primary and community care. Second, from analogue to digital. No longer will NHS staff have to enter 7 passwords to log into their computers, or spend hours writing notes and entering data. Our plan will liberate frontline staff from the parts of the job they hate so they can focus on the job they love, caring for patients. For the first time ever, patients will be given real control over a single, secure and authoritative account of their data. The single patient record will mean NHS staff can see your medical records and know your medical history so they can provide you with the best possible care. Wearable technology will feed in real-time health data so patients' health can be monitored while they stay in the comfort of their own home, with clinicians reaching out at the first signs of deterioration. The NHS app will become the front door to the health service, delivering power to the patient, You'll be able to book and rearrange appointments for you, your children, or a loved one you care for. Get instant advice from an AI doctor in your pocket. Leave feedback on your care and see what feedback other patients have left. Choose where you're treated. Book appointments in urgent care so you don't wait for hours. And refer yourself to a specialist where clinically appropriate. And of course, patients can already do these things, but only if they can afford private healthcare. With Labour's plan, every patient will receive a first-class service, whatever their background and whatever they earn. Third, from sickness to prevention. Working with the food industry, we will make the healthy choice the easy choice to cut calories. We'll roll out obesity jabs on the NHS. We'll get Britain moving with our new NHS points scheme. We'll update school food standards so kids are fed healthy, nutritious meals. And we will tackle the mental health crisis with support in every school to catch problems early, 24/7 support with virtual therapists for moderate need, and dedicated emergency departments for patients for when they reach crisis point. Madam Deputy Speaker, the science is on our side. The revolution in artificial intelligence, machine learning and big data offers a golden opportunity to deliver better care at better value. New innovator passports and reform of NICE and the MHRA will see medicines and technology rapidly adopted. Robotic surgery will become the norm in certain procedures, so patients recover from surgery at home rather than in hospital beds. And the NHS will usher in a new age of medicine, leapfrogging disease, so we are predicting and preventing it rather than just diagnosing and treating. It is therefore the ambition of this plan to provide a genomic test for every newborn baby by 2035. And thanks to my right honourable friend, the Chancellor, this plan is backed by an extra £29 billion a year by the end of the spending review period, and the biggest capital investment in the history of the NHS. Of course, alongside that investment comes reform. This plan slashes unnecessary bureaucracy and devolves power and resource to the front line. It abolishes more than 200 bodies because listening to patients, guaranteeing safety and protecting whistleblowers is core business for the NHS and should never have been outsourced. It commits to publishing league tables to rank providers. We will intervene in failing providers to turn them around and reinvent the foundation trust model in a new system of earned autonomy. Pay will be tied to performance, so excellence is recognised and failure has consequences. Tariffs will be reduced to boost productivity. Block contracts will end with funding tied to outcomes. The plan gives power to the patient, so hospitals are financially rewarded for a better service. It closes health inequalities by investing more in working-class communities. And it establishes a national investigation into maternity and neonatal services to deliver the truth, justice and improvement that bereaved families deserve. Madam Deputy Speaker, I'm sometimes told that NHS staff are resistant to change. On the contrary, they're crying out for it. They suffer the moral injury of seeing their patients treated in unfit conditions. And they're the ones that are driving innovation on the front line. And so their fingerprints are all over this plan. The public are desperate for change too. Each of us has our own story about the NHS and the difference it has made to our own lives. And we also know the consequences of failure. That is why we cannot afford to fail. But to succeed, we need to defeat the cynicism that says nothing ever changes. We know the change in our plan is possible because it's already happening. We've toured the length and breadth of the country and scouted the world for the best examples of reform. If Australia can effectively serve communities living in the outback, we can surely meet the needs of rural England. If community health teams can go door to door to prevent illness in Brazil, we can certainly do the same in Bradford. We know that we can build the Neighbourhood Health Service because teams in Cornwall, Camden, Northumbria and Stratford, where I was with the Prime Minister and Chancellor this morning, are already showing us how to do it. So we will take the best of the NHS to the rest of the NHS, and we will apply the best examples of innovation from around the world to benefit people here at home. Above all else, we will give power to the patient. This plan fulfills Nye Bevan's commitment in 1948 to put a megaphone to the mouth of every patient. And it will restore the founding promise of the NHS to be there for us when we need it. Yeah. Of course, we know there are those on the right who are willing us to fail. They will exploit the crisis in the NHS in order to dismantle it. The Honourable Member for Clacton and his cronies argue that universal healthcare that could be afforded in the 20th century, but not in the 21st. Well, Madam Deputy Speaker, Labour rejects their declinist pessimism. And so do the public. But that is the choice, sat right there. It's change or bust, and we choose change. And we know the British people are counting on us. It falls to us to make sure that the NHS not only survives but thrives, and we will not let our country down. And of course, if we succeed, we will be able to say with pride that will echo down the decades of the 21st century that we were the generation that built an NHS fit for the future and a fairer Britain where everyone lives well for longer. And I commend this statement to the House.
I call the Shadow Secretary of State, Ed Argo.
Thank you, Madam Deputy Speaker. And can I thank the Secretary of State for his typical courtesy in not only providing advance sight of his statement, but in fact of his plan itself. I'm grateful to him, and others on his front bench might learn a thing or two from him. And I'm pleased to see this plan published. This Secretary of State is a rare thing these days. He's a Secretary of State whose announcements do tend to survive largely intact for more than a week. And in the case of this plan, it's vital that it does stick. Now, the Secretary of State is not known to be short on ambition, and to be fair, this is reflected in his plan today. It is ambitious. I believe his long-term goals are right, and that the reforms he sets out today build on the reforms we set out and carried out. The desire to shift care from hospital to community, to better use technology and to move to prevention are not new at all, but they remain vital. Now, the NHS undoubtedly needs reform, not just more cash. 38% of day-to-day government spending going on the NHS is simply not fiscally sustainable in the long term. We need to focus on outcomes, not just inputs. But this plan, while welcome, is still sketchy on some of the details of delivery and how it will be paid for without the funds he's mentioned being eaten by pay rises and by inflation, and actually how the shift will be staffed. Greater use of the app is right and builds on the amazing work done on the app by the Right Honourable Member for North East Cambridgeshire when he was Secretary of State. Greater use of technology and of genomics is right. And his big five tech bets are largely right. But tech alone, as he knows, won't deliver this. People will need to deliver this. And so a clearly aligned workforce plan with his strategy is vital. Now, neighbourhood health centres are one of the measures at the heart of his plan today. The concept is an interesting one, but it does throw up a number of questions which I hope he can answer today in the spirit in which they're asked. Will the providers of those new centres be NHS public sector or private sector organisations, or a mixture? How will the centres fit with GP provision and other services without duplication or fishing in the same pool for staff? What assessments he made of the cost of new buildings and technology to go in them, and how many of these centres does he envisage and by when? And crucially, how will he ensure that a PPP model will avoid the downsides of the Blair-Brown PFI model? Now, I ask not from a desire to see this fail, but for it to succeed, because it's in all our interests that he does succeed. But that will take time. Now, on page 71 of his plan, he talks about the need for immediate opportunities to be seized, given that. Can I take the opportunity to suggest just one, there will be others, to him, which would be to deliver on pre-election commitments for fracture liaison services to be delivered in all communities, as campaigned for by the Royal Orthopaedic Society, the Mail on Sunday, the Express and many others. And that's a policy which would deliver savings within the CSR period. Similarly, in my own constituency, Melton Mowbray has a fantastic community hospital. There will be many up and down this country. I hope they will be a part of delivering more services in the community. On maternity care, I welcome his commitment to a national investigation into maternity scandals. But I hope that won't stop him from delivering on the work that was done by the Honourable Member for Canterbury and by Theo Clark, where there are measures that can be implemented now to help improve maternity safety. On systems reform, can I offer him a couple of words of caution? One on folding HSIB into the CQC, even as a discrete entity within it. HSIB is not a regulator and is not designed as such, and it's important that those distinctions are not blurred in how that change happens. And similarly, on ICBs, can I urge him to be wary of further moving those to larger geographies, at risk of becoming, again, the old regional health authorities, as that will move them further away from the local communities that they are serving, and also the entities that provide social care in those communities with whom they must interact. Which does bring me, finally, to a very significant question hanging over this plan. Unless we move faster to address the challenges of social care and put it on a sustainable footing, these reforms risk failing to seize the genuine opportunity presented. I think in the move from cross-party talks to an independent commission, we risk losing the opportunity that is there. But crucially, again, I ask the Secretary of State to consider bringing forward the end date of that commission so we can go further and faster on social care. To conclude, Mr Deputy Speaker, I've often said to the Secretary of State that where he is wrong, we will rightly hold him to account and challenge him. But where he is right, we will offer constructive support. This plan, by and large, does say, in my view, the right things. We must shift to outcomes and not focus continually on inputs, and we must do that through real and genuine reform. The challenge he faces will be in the detail, much of which is still to be confirmed, and crucially for the government, in actual delivery. The Secretary of State should not underestimate those challenges. I will work with him to improve this plan where it needs it, but also to support him where he pledges and brings genuine reform to our healthcare system. His plan will have a key test. Will patients see the difference, and when will they see the difference? Because it is vital as we reform our NHS, that in all we do, it is patients that are at the heart of our deliberations and our plans.
Secretary of State.
Thank you, Mr Deputy Speaker. Can I first of all thank the Shadow Secretary of State for the constructive approach he's taking to what does need to be a successful plan for the next decade, to get our NHS back on its feet, to make it fit for the future and to make sure we improve the health of the nation. Aside from the lines he was no doubt given to trot out, and he almost said them with conviction at the beginning, we know that we can count on him to be rather more serious and sensible than the display we saw from that bench yesterday. Turning to his points, so he's right to say that the investment needs to go alongside the reform, and that's why the spending review set out the Chancellor's commitment to the NHS and to NHS reform only a matter of weeks ago. The government's providing a £29 billion real terms increase. That's a £53 billion cash increase in annual NHS day-to-day spending by 2028-2029. This funding will support the first steps towards delivering the reforms, the service improvements and the new technology set out in the plan. But investment alone isn't enough. One of the reasons why we're paying more and more for worse and poorer outcomes is because we've got the wrong care in the wrong place at the wrong time. And contrary to what we hear in some newspaper columns, and I heard the Honourable Member for Clacton on the radio this morning once again attacking the NHS's equitable principles and funding model, it's not the model of funding that's the problem, it's the model of care. And that's why the shift to neighbourhood health is absolutely essential for delivering better outcomes for patients and better value for taxpayers. And with the technology that's coming down the track, indeed the technology we already have, that will drive the big productivity gains in the system that have eluded us. Because what we've seen in recent years, and thinking back to the previous government, they did invest more staff, but they put all of those staff in hospitals. They were working in an undercapitalised NHS. And so if you've got more going into the inputs, if you don't have the enablers to deliver the service and you don't see the responding improvements in outputs and impact, that is how you drive poorer productivity, poorer value for money and poor outcomes for patients. And that is the approach we're changing. If, for example, we roll out, as we will, ambient AI to all GPs, and make sure that in those interactions with patients, we liberate them from being glued to the screen, filling out the forms, drafting the letters. That's all done automatically before the GP spends a few moments checking over to make sure it's right. If we could just save 90 seconds in every GP appointment, we will save the equivalent GP time of 2,000 more GPs. That is how we get more bang for the buck. That's how we drive productivity improvements. That's how we deliver better care and better value. And that's why the workforce plan of the previous government wasn't right, because it assumed that the NHS just needed growth on the same rates and in the same way as it's always done things. And in fact, so implausible were the assumptions in that plan that if we'd continued with the rate of growth that they had set out, by the end of the century, 100% of our entire country would be working in the NHS. Now, I know we love the NHS and we love the people who work in it, but I don't think everyone in our country can or should be working in the National Health Service. And so to reassure the right honourable gentleman, we will this autumn set out a new workforce plan that aligns with this 10-year plan. He asked about neighbourhood health centres. We aim to go for 250 to 300 new neighbourhood health centres by the end of this plan, 40 to 50 over the course of this Parliament. They will be NHS providers and we'll be doing a combination of new builds and also refurbishing and rejuvenating underutilised existing estate both in the NHS and in the public sector. And therefore the cost of each neighbourhood health centre will vary from the low millions to around £20 million, depending on whether it's an upgrade and a refurb and an expansion or indeed a new build. And because of the undercapitalisation of the NHS that we inherited, even with the record investment from public sources the Chancellor has provided, that in itself will not be enough to deal with the capital backlog. And that's why, as set out in the government's infrastructure plan, and with care and caution, and keeping in mind the mistakes that were made by the private finance initiative, we are looking at alternative private sources of investment to make sure we can go further and faster on capital improvement, particularly in the Neighbourhood Health Service. He asked me to commit to, again, to fracture liaison services. Mr Deputy Speaker, fracture liaison services have a demonstrable impact on keeping people well and of providing both better outcomes for patients and better value for taxpayers. And that's why we want to see them rolled out across the country. In maternity, I very much welcome his support for the investigation. NHS England is in the third of the 3-year plan put in place by the previous government, and we've sought to support that progress and not to interfere. But as we've seen, even with the most recent CQC report into the trust in Nottingham, we have got so much more to do, and it needs an entire change in approach and culture, let alone practice and behaviour. So I am committed to working with all party parliamentary groups across this House and to make sure that the expertise and insight we have right across these benches on both sides of the chamber helps us to drive maternity improvements. He asked about rolling HSIB into the CQC, so let me provide this reassurance to him. HSIB has been a really effective body. But we can't justify the duplication of back office functions and the inefficiency that comes with that. However, the CQC, when we came into office, was in such a dire state we had to replace the leadership, and we have in place an improvement plan. So the House has my assurance that we will not roll HSIB into the Care Quality Commission until we are assured that the Care Quality Commission is back to the standards that we expect for it to perform its core duties today, let alone the work it will do with HSIB housed within the CQC. On ICBs, Look, I'm not going to measure success through the number of bodies in the NHS. I think that's led us to where we are. But I am committed to make sure that as we devolve more power, more responsibility, more resource closer to the front line to system leaders and provider leaders, we also make sure we have in place democratic accountability so that members of Parliament, local councils, metro mayors can influence and shape healthcare where they live. He also asked about social care. Well, we're not waiting for Casey. The spending review gave an additional £4 billion to social care. We're delivering the biggest expansion of carers allowance since the 1970s, a significant increase in the disabled facilities grant, and the Deputy Prime Minister and I will shortly be setting out how we will deliver the first ever fair pay agreements for the care workforce, building a real social care progression. And finally, Mr Deputy Speaker, on neighbourhood health, social care has to be part of it. In the context of this plan, social care features because it has a role to play on admission avoidance and speeding up delayed discharges. But of course we know that social care is important in its own right, and that's why it's important it has its own commission. Finally, the Shadow Secretary of State asked about whether people will see and feel these improvements. We know on this side of the House that we will be judged by results and whether people can feel the change that we are delivering. So all I would say to people watching our proceedings today is that in our first year, we promised 2 million more appointments to cut waiting lists. We doubled that. We promised to deliver 1,000 more GPs. We've almost doubled that. And we promised within our first year that you would see the NHS moving in the right direction, and waiting lists are lower now, lowest point for 2 years. Now we know there's more to do, but I hope the progress you've seen under this Labour government reassures you that when it comes to our National Health Service, if anything, we under-promise and over-deliver. We know that people will see and feel the change, and I say respectfully, given his constructive tone, that will be the difference between a Labour government and a Conservative one.
Now I call the Chair of the Select Committee, Pauline Hampton.